Good afternoon, everyone. We're going to get this meeting of the Health and Human Services Subcommittee started, and we will start with the Office of Deaf and Hard of Hearing. And just a general announcement, if there's if it's agreement from the agency and the House concurred, just take it unless you all say something that we're going to concur. All right, thank you.
Good afternoon. For the Office of the Deaf and Hard of Hearing, on page 1 of the white packet, DLS recommendation is to concur with governor's allowance. The agency concurred, House adopted. And on page 1 of the blue packet, there's language that restricts funds for the Office of the Deaf and Hard of Hearing until the agency submits a report indicating it has published the state sign language licensing requirements.
Mr. Chair, we'll concur with item 1 on page 1, and then we'll adopt blue color page 1.
Thank you.
On page 2 of the white packet for the Department of Disabilities, DLS recommendation is to concur with governor's allowance. Agency concurred and House adopted.
Thank you.
On page 3, we have the boards, commissions, and offices. Action number 1 is a language restricting funds pending submission of agency MB participation report. The agency disagreed and requested the due date to be modified from December 1st, 2025 to January 15th, 2026. The House modified this action, which is at the bottom of page 3, continuing to page 4, and changed the due date to January 1st, 2026.
Move to concur with the House modifications.
Thank you.
On page 5, recommendation. This is a additional first House action, which is a committee narrative requesting a report on county executive ethics law. The House adopted.
Concur with the House.
Thank you.
There is also an additional DLS recommendation related to supplemental budget number 1 on page 2 of the blue packet. The DLS recommendation was to delete 5 new positions and associated fundings for the Office of Immigrant Affairs. The first House rejected this action.
Move to adopt color page 2.
Thank you.
Page 6, Secretary of State. DLS recommendation is to concur with governor's allowance. Agency concurs and the House adopted.
Thank you.
On page 7 for the Department of Aging, the DLS recommendation was to reduce $2.5 million for the senior care program in fiscal 2025. The agency disagreed and the House modified the DLS recommendation to only reduce $900,000 instead of $2.5 million.
Move to reject.
Thank you.
On page 8 for the Maryland Commission on Civil Rights, DLS recommendation is to adopt committee narrative requesting a report on impact of new positions on case assignment and backlog management. The agency concurred and House adopted.
Okay.
On page 10, moving on to Military Department. Recommendation number 1 is a committee narrative requesting a report on Maryland on the department's efforts to fill vacant positions. The agency did not provide any response, but the first House adopted.
Concur with the House.
Recommendation number 2 is to reduce 4 long-term vacant positions within the Army Operations and Maintenance Program. The agency disagreed. The first House adopted.
Move to reject the House action.
Recommendation number 3 also is to reduce 1 long-term vacant positions within the State Operations Program. The agency disagreed and the first House adopted.
Sure, I would move to reject the House action.
Thank you.
Page 11, recommendation number 4 is a committee narrative requesting a report on TRICARE Premium Reimbursement Program participation. The agency did not provide any response. The first House adopted.
Concur with the House.
On page 12, in the Maryland Institute for Emergency Medical Services Systems, DLS recommended concurring with the governor's allowance. The agency concurred and the House adopted.
Thank you.
On page 13, in the State Archives, DLS recommended concurring with the governor's allowance. The agency concurred and the House adopted.
Thank you.
For the Maryland Health Benefit Exchange on page 14, the first recommendation was to reduce funding relating to new positions. The agency concurred in part and the House adopted.
Concur with the House.
The second recommendation was to adopt narrative requesting an annual report on the reinsurance program. The agency did not provide a response and the House adopted.
Concur with the House.
Thank you.
The third recommendation was to add language that makes a portion of the funding for the Young Adult Subsidy Program contingent on legislation that extends the program. The agency concurred in part and the House adopted.
Concur with the House.
On page 16, in the West North Avenue Development Authority, DLS recommended adding language making a new position contingent on legislation. The agency concurred and the House adopted.
Okay.
Item number 2, DLS recommended reducing funding for grants to non-governmental entities. The agency disagreed and the House adopted.
Move to reject the House action.
Thank you.
On page 17, the first recommended action for the State Department of Assessments and Taxation is to restrict general funds pending 2 reports on the status of the Cloud Revenue Integrated System Major IT Project. The agency concurred and the House adopted.
Okay.
On page 18, the second recommended action is to adopt committee narrative requesting 2 reports on vacancies among assessors in the Real Property Valuation Program. The agency concurred and the House adopted.
Okay.
Moving to the blue additional page packet, page 3 restricts general funds pending a report on long-term vacancies.
Move to adopt color page 3.
Thank you.
Back to the decision document. Page 20 contains a recommendation for the Property Tax Assessment Appeals Board to adopt committee narrative requesting the agency to submit its late managing for results data. The agency concurred and the House adopted.
Concur.
Once again, moving to the additional page packet. Page 4 restricts general funds pending a report on the backlog of cases in Baltimore City.
Move to adopt
Thank you.
color page 4.
On page 21, in the Maryland Department of Health Administration, DLS recommended adopting committee narrative requesting a report on bed capacity and patient length of stay at Perkins Hospital Center. The agency concurred and the House adopted.
Concur.
On page 23, DLS recommended striking new positions that were added in the supplemental budget, and the House adopted.
Concur with the House.
On page 24, in the Office of Healthcare Quality, the DLS recommendation was to concur with the governor's allowance. The agency concurred and the House adopted.
Concur.
On page 25, in the Health Professional Boards and Commissions, the recommendation was to reduce special funds in the Board of Nursing to address a technical error. The agency concurred and the House adopted.
Concur.
On page 26, in the Public Health Administration, DLS recommended restricting funding pending the submission of fiscal 27 budget data for local health departments, separated by salary increments versus grants. The agency concurred, the House adopted.
Mr. Chair, I'd move to modify the House action to increase funding restriction amount and alter release of fund schedule.
Thank you.
And then in your additional page packet, on page 5, there is budget bill language for your consideration that would restrict funding pending the submission of a report on the funding match regulations for local health departments.
Move to adopt color page 5.
Thank you. Adopt.
On page 27, DLS recommended reducing general funds for core public health services. The agency disagreed and the House adopted.
Concur with the House.
Thank you.
On page 28, DLS recommended reducing general funds in the Prevention Health Promotion Administration. The agency disagreed and the House adopted.
Concur with the House.
On page 29, in the Behavioral Health Administration, DLS recommended restricting fundings pending the submission of reports on provider reimbursement data. The agency concurred in part, proposing that they submit the information in a different way. The House modified the recommendation, which is included on page 30, to change how the report is submitted.
Mr. Chair, I move to concur with the House modification.
Concur.
On page 31, starting on page 31, there's 4 pieces of annual language that restrict funding in Behavioral Health Administration to provider reimbursement programs. Their recommendations 3, 7, 8, and 9. The agency disagreed and the House adopted.
I move to concur with I concur with the House on item 3.
3, 7, 8, 9.
Recommendation 4 on page 31 was to reduce $9.9 million in general funds. The House modified to instead reduce $6.9 million and adopted that modification.
Should we hold it?
I think we were taking that.
Take it? Okay. I move to concur.
Yeah, concur.
At the bottom of page 31,
I just want to make sure, sir, we thought through, and I know we did, so thank you.
Yes, sir.
Yeah.
recommendation 5 at the bottom of page 31 was to delete the appropriation for the 1% provider rate increase in the provider reimbursement programs in BHA. The agency acknowledged the response and the first House rejected the recommendation.
We concur with the House to reject.
So recommendation 7, 8, and 9 you have concurred with. Those are the annual language. Recommendation 10 on page 33 is to reduce funding in fiscal 2025. The agency disagreed and the House adopted.
Is it for item 9?
Item number 10.
Number 10, I would reject the House action.
Thank you.
Then in your additional pages packet on page 7, there's additional budget bill language for your consideration that would restrict funding for the Behavioral Health Crisis Response Grant Program.
Move to adopt color page 7.
On page 8, there's committee narrative that would require the Health Department to submit a report on the Behavioral Health Crisis Response Grant Program.
I would move to adopt color page 8.
On page 9, there's committee narrative that would request an update on the transition to the new Administrative Services Organization.
I'd move to adopt color page 9.
On page 10, there's committee narrative that would request a report on the timeliness of payments to local nonprofit core service agencies.
I'd move to adopt color page 10.
And then on one of the loose leaf pages for the Behavioral Health Administration, apologies, this is actually a modification of recommendation number 2, a modification of the House modification. So this is found on page 30. And this would change the way that the funding is released pending submission of reports on a quarterly basis.
I'd move to adopt that color page.
Thank you.
And then turning back to the decision document on page 34, the House adopted language that would restrict $3 million for pediatric hospital overstays.
Move to reject.
The House also adopted language to restrict funding for drug testing kits in institutions of higher education.
Move to reject.
The House adopted narrative requesting a report on spending to address pediatric hospital overstays.
Move to concur with the House.
And then the House also adopted on pages 35 and 36 narrative to request a study on the cost savings associated with certified community behavioral health clinics.
Mr. Chair, I'd move to concur with item 4 and 5.
Thank you.
Great. And then item 5 was just a technical correction to the supplemental budget, which the House also adopted.
On page 38 in the Developmental Disabilities Administration, the first recommendation was to add language restricting funds pending a fiscal closeout report and budget amendments. The agency concurred and the House adopted.
Concur with the House.
The second recommendation on page 39 was to add language restricting funds pending the resolution of repeat audit findings. The agency concurred and the House, the second recommendation is relating to a report on community services spending. The House modified on the next page, page 40, to change the due dates.
I would move to concur with the House modifications.
Thank you.
On page 42, recommendation 3 was restricting funds pending the resolution of audit findings. The agency concurred and the House adopted.
Concur.
On page 43, recommendation 4 was annual language restricting funds to the community services for that purpose only. The agency disagreed and the House adopted.
Concur with the House.
Recommendation 5 was to reduce funding for the 1% provider rate increase. The agency acknowledged the response and the House rejected.
We concur with the House. We'll reject the cut.
There were also a couple of additional first House actions, recommendations, beginning on page 44. Recommendations, or items 1, 2, 3, and 4 restrict certain cost containment actions and specify how certain cost containment actions should be implemented.
Mr. Chair, I would move to concur with all 4 the House actions on item 1 through 4.
Thank you.
Turning to the additional page packet, there's also an item relating to cost containment on page 11. This additional action restricts funds pending a report on the implementation of cost containment actions.
I'd move to adopt.
There's also a loose leaf page relating to DDA. So this loose leaf adds language prohibiting DDA from implementing a dedicated hours policy that considers the availability of shared hours and specifies how dedicated hours removed from an individual's plan should be reinstated.
Move to adopt.
Moving back to the decision document on page 46. This was an additional first House action that was a technical change to Amendment 4 in the supplemental budget to correct the line references.
Concur with the House.
On page 47 of the decision document, this begins actions related to the Medicaid budget. The first item, DLS recommends annual language that restricts Medicaid funds to that purpose, but allows transfers to behavioral health spending. The agency disagreed, and the first House adopted.
We'll concur with the House.
Item 3 on page 47, this is a recommendation to reduce funds for the Population Health Incentive Program. $11 million of this reduction was taken in Supplemental 1, so the first House modified this to reduce the remaining funds.
Concur with the House modifications.
On the next page, item 4, DLS recommends reducing funds to set MCO rates at the lowest actuarially sound level. That was item 4 shows the original recommendation based on updated information. The revised recommendation is to reduce $25.1 million in total funds for MCO rates, and the first House adopted that revision.
Move to concur with the House.
Item 5, the recommendation is to delete funding for the 1% provider rate increase for LTSS providers. The agency acknowledged the recommendation. The first House rejected.
We agree with the House. We'll concur with the House on that rejection.
Item 7, DLS recommends reducing the enhancement for physician evaluation and management rates to instead level fund them. The agency disagreed, and the first House adopted.
We'll concur with the House.
Item 8, DLS recommends reducing funding for housing support waiver services. The agency disagreed, and the first House rejected.
We'll concur with the House. We'll reject as well.
On page 49, item 9, DLS recommends reducing funds for the health home program as a technical correction. The supplemental budget took this reduction, and so the first House rejected this action.
We'll concur with the House.
Item 10, DLS recommends reducing provider rates for home and community-based service providers under Medicaid by 2%. The agency disagreed, and the first House rejected.
We'll reject as well. We concur with the House.
Item 11, DLS recommended reducing funds for Medicaid based on reduced enrollment expectations. The agency disagreed, and the first House adopted.
We'll concur with the House. Move to concur.
Item 12, DLS recommends adopting narrative requesting a report on the Community First Choice Program and the Community Options Waiver. The first House adopted.
Move to concur with the House.
Moving to page 51, item 13, DLS recommends adopting narrative requesting quarterly reports on Medicaid enrollment. The first House adopted.
Move to concur with the House.
On page 52, item 14 is a recommendation for narrative requesting reports on the evaluation of primary care programs. The agency concurred. The first House adopted.
Concur with the House.
On page 53, item 15 is more annual language restricting funds for the MCHIP program to that purpose or allowing transfer to Medicaid. The first House adopted.
Concur with the House.
Item 16, the recommendation is to reduce funds from the Maryland Children's Health Program based on recent enrollment expectations. A portion of this was reduced in Supplemental 1, and so the first House modified this to reduce the remaining funds.
Concur with the House modifications.
On page 54, item 17, DLS recommended deleting 13 long-term vacant positions. 5 of these positions were transferred as part of the supplemental budget, and so the first House modified to reduce the remaining 8 positions.
Concur with the House modifications.
Item 18 at the bottom of that page, DLS recommended reducing funds for the Population Health Incentive Program in fiscal 2025. This reduction was taken in the supplemental budget, and so the first House rejected it.
Concur with the House.
On page 55, item 19, the recommendation was to reduce $151 million in general funds, $110 million in federal funds. And so the first part of this was to recognize the risk corridor recoveries. This was accounted for in the supplemental budget. And so then the remaining recommendation is to reduce $100 million in general funds, and the first House modified that to be accounting for an expected rainy day fund transfer that was authorized last year.
I move to concur with the House on modifications.
On page 56, the first House had an additional action to adopt committee narrative requesting a report on end-stage renal dialysis coverage. First House adopted.
Move to concur.
In the additional page packet on page 14, there's a DLS recommendation to reduce funding for biomarker testing, and the first House rejected this recommendation.
Move to reject.
Okay. Reject the reduction in the biomarker testing, yep. And then there's a loose leaf page for Medical Care Programs Administration. This would add language restricting funds pending the receipt of a report on end the wait activities.
Do you want to up this amount?
Yeah, I think it's supposed to be restricted at 500,000.
Okay, so adopt but modify to 500,000. Okay. And then back to the decision document on page 57. This is for the Health Regulatory Commissions. The DLS recommendation was to concur with the allowance. The agency concurred, the first house adopted. I will turn your attention to page 15 of the blue packet. This would be language restricting $250,000 pending a report on Medicare Advantage plans under the AHEAD model.
I'd move to adopt with the, including color page 15.
JB?
Moving on to page 17, this would be narrative requesting a report on registered apprenticeships in hospitals.
Move to adopt.
And then on page 18, this action revises the contingent reduction for the consortium to match the blueprint bill the Senate position is for this.
Move to adopt.
On page 58, for the DHS administration, DLS recommendation is to adopt narrative requesting a report on the cost, implementation progress, and long-term sustainability of MD Think. The agency concurred in part and requested to change the due date to December 1st, 2025. House modified the due date.
Move to concur with the House modifications.
Thank you.
Social Services Administration starts on page 61 of the white packet. I'll be talking about item 1 and 2 together. Item 1 restricts funds pending submission of a report on hospital stays by youth in out-of-home placements, and item 2 restricts funds pending submission of report on hotel stays. The agency requested these two reports be combined. On page 63 is the House modification that combines the report on hospital and hotel stays.
Yeah, I would just make a motion to modify to change the report due date to November 1st, 2025.
Thank you.
Item 3 on page 65 restricts funds pending submission of a report on child welfare services cases and positions required. The agency concurred and the House adopted.
Concur.
Item 4 on page 67 restricts funds pending submission of MFR data. The agency concurred and the House adopted.
Concur.
Item 5, starting on page 68, is a committee narrative requesting an update on the implementation of provisions of Federal Family First Prevention Services Act. The agency concurred and the House adopted.
Concur.
Item 6 on page 70 is a committee narrative requesting a report on child fatalities. The agency disagreed. The agency noted that if the report was required, the due date be changed to January 7, 2026. House modified the due date to January 7, 2026.
And move to concur with the House modification.
Item 7 is an annual language restricting general funds appropriated for foster care maintenance payments to that use only. The agency concurred and the House adopted.
Concur.
Item 8 on page 71 reduces general and federal funds within foster care maintenance payments program. The reduction is associated with 5% rate reduction for institutional providers. The agency disagreed and the House rejected.
We want to concur with the House.
Item 9 on page 71 is a committee narrative requesting monthly data on out-of-home placements of children and youth. The agency disagreed. The House adopted the narrative. There is an additional page 19 on the blue packet, that modifies this recommendation to request update on Social Services Administration data dashboard.
Mr. Chair, I'd move to modify the report by adopting color page 19.
Thank you.
Item 10 on page 72 is a committee narrative requesting a report on the second phase of rate reform. The agency concurred and the House adopted.
Concur.
Item 11 on page 73 is a committee narrative requesting a report on costs associated with youths in out-of-home placements placed in hotels. The agency concurred with the recommendation. House modified to clarify the data should be provided as a sub-program within the foster care maintenance payments, which is on page 73 as well.
We would move to concur with the House modifications.
Item 12 on page 74 is annual language that restricts general fund appropriated for child welfare services program to that use only or to be transferred to foster care maintenance payment. The agency concurred and the House adopted. Item 13 on page 74 is a language restricting general funds appropriated for foster care maintenance payments deficiency to that use only. The agency concurred and the House adopted. On page 75, we have the additional first House action that restricts funds in DHS and MDH pending submission of a report on meeting discussing child fatalities.
Mr. Chair, I'd modify to the restriction to be $250,000 per agency.
Thank you.
On page 76, for DHS Child Support Administration, the last recommendation is to adopt narrative requesting a child support performance report. The agency concurred in part. They requested to change the due dates, and the House modified the due date.
Move to concur with the House modifications.
Turning to page 79, this begins the Family Investment Administration. Recommendation 1 restricts funds in the Office of the Secretary pending fiscal 2025 closeout information. The agency concurred in part. The first House adopted.
Concur with the House.
Recommendation 2 on page 80 restricts the funds in the Assistance Payments Program to be used for that purpose. The agency disagreed. The House adopted.
Concur with the House.
Recommendation 3 on page 81 reduces administrative funds for the Sunbucks program based on current staffing levels and overall vacancy savings in the administration. The agency disagreed and the first House adopted.
Concur with the House.
Recommendation 4 reduces the rest of the administrative funds for the Sunbucks program, which you'll see later in a recommendation to add back to an administrative program. The agency concurred and the first House adopted.
Concur with the House.
Recommendation 5 reduces funding for the Public Assistance to Adults program to better reflect caseload trends. The agency disagreed and the first House adopted.
Concur with the House.
Recommendation 6 on the top of page 82 reduces federal funds for the SNAP program based on the caseload. The agency disagreed and the first House adopted.
Concur with the House.
Recommendation 7 is committee narrative requesting a report on Sunbucks participation and administration. The agency concurred in part, preferring a December 1 due date, and the House modified to the December 1 due date.
We'd move to concur with the House modification.
Moving ahead to page 85, recommendation 8 restricts funds pending the resolution of repeat audit findings. The agency disagreed. The first House adopted.
Concur with the House.
Recommendation 9 on page 86 and continuing on to 87 restricts funds pending quarterly reports on application processing times, denial rates, and case closures. The agency concurred and the first House adopted.
Concur.
On page 88, recommendation 10 restricts funds pending a report on the implementation of the voluntary settlement agreement. The agency concurred in part, preferring funds not to be restricted. The first House adopted.
Concur with the House.
On page 89, recommendation 11 restricts the funds for a deficiency appropriation for the TDAP program to be used only for that purpose. The agency concurred and the first House adopted.
Concur.
The recommendation 12 is the second part of the one I mentioned earlier. So this adds the administrative funds for the Sunbucks program to the director's office. So, and the agency concurred and the first house adopted.
Concur.
On page 20 of the blue package is language that restricts funds pending a report on the grants administration process in the Office of Grants Management.
Move to adopt color page 20.
That's all I have.
The Office of Home Energy Program starts on page 91 of the white packet. Item 1 reduces general funds for miscellaneous personnel expenses. The agency concurred and the House adopted. Item 2 on page 91 restricts funds pending submission of the report on energy assistance application processing time. The agency concurred and the House adopted. Item 3 on page 92 reduces special and federal funds associated with communication expenses in fiscal 2026. The agency concurred in part. They requested the federal funds associated with communications expenses be provided. The House modified to provide the federal funds, which is on page 93. Item 4 on page 93. 23 million of fiscal 26 allowance was leveled as expense for a call center, which was an error. This language restricts the use of that fund for energy assistance benefits to ensure the funds are used for the intended purpose. The agency concurs and the House adopted. Item 5 is a committee narrative requesting MFR data. The agency requested the fiscal year reporting interval be federal fiscal year instead of state fiscal year. The House modified to make the reporting interval federal fiscal year. Item 6 on page 94 reduces special and federal funds associated with communication expenses in fiscal 25. The agency requested the federal funds be provided. House modified to provide the federal funds.
Concur.
On page 96, in the Department of Housing and Community Development, DLS recommended reducing one new position. The agency disagreed. The House adopted. And then finally, on page 22 of your blue additional pages packet, there's committee narrative for your consideration that requests a report on the implementation of the Rental Assistance for Community School Families program.
Move to adopt.
Thank you. Is there a motion?
Chairman, I'd move to move favorable on the subcommittee report.
There's been a motion and a second. All those in favor?
Aye.
Opposed? Motion approved. I just want to lean in and say thank you to each and every one of the analysts that help us get the navigation right and go in the right direction. You all, this ends our HHS hearing for today. Thank you.